Fever is sweeping across Central African countries and has global health experts worried. The outbreak was first reported in Angola in December of last year and has left nearly 300 people dead, with nearly 2,300 suspected cases. The Democratic Republic of the Congo last week declared the outbreak in their nation an epidemic. Now, some reports have recorded a few cases in Kenya and as far afield as China. Now, joining us in studio this morning is Doctors Without Borders Senior Humanitarian Policy Advisor Jens Pedersen. Jens, very good morning to you. Thank you for joining us this morning.
Morning, Ian. Thanks for having me.
Just give us a quick overview. How serious is the situation in countries where MSF are operational?
So we focused our attention on the hardest affected countries, as you mentioned, Angola and the Democratic Republic of Congo. The situation remains concerning, and it's important that we remain very, very vigilant in trying to make sure that the outbreak doesn't spread. There's no treatment for yellow fever. The most effective way to prevent this outbreak from spreading is through vaccination. So we need a greater rollout of vaccinations. In DRC, MSF has helped the Ministry of Health in vaccinating 350,000 people in May already. And the Democratic Republic of Congo is awaiting arrival of 2.2 million vaccines to try and stem the outbreak.
Now I've seen reports about shortages of vaccines across the continent. That must be very concerning. Just paint us that picture.
Well, unfortunately, the reality is that some of these diseases which affect countries in Africa and affect poor countries in Africa, there is not a ready availability of the vaccines at hand. And in large outbreaks, as now, we've seen, as you say, a shortage. So production have had to be rapidly scaled up, and we're now awaiting actual supply for any further vaccination in the Democratic Republic of Congo.
Can you, for the uninitiated, can you tell us what yellow fever is, how it plays out in people's lives, and what it looks like, what people should be on the lookout for, and so forth?
So yellow fever is transmitted by a mosquito, the same mosquito as carried dengue or Zika virus, for example. And it brings along symptoms such as fever, body ache and joint pains, symptoms which are very similar to diseases such as malaria. However, if unattended to, the yellow fever virus can, as we've seen in almost 10% of the cases, have fatal outcome. And it's called yellow fever because what is called jaundice, which is when the patient is left unattended to medically, develops an almost yellow light in their skin and in their eyes.
Talk to us about cost of vaccination and these kinds of scenarios. I understand the cost is quite high, and in low-income countries this can be problematic.
It is indeed very problematic for countries to afford the vaccine. The irony is what we have seen in Angola, for example. Angola is deemed as a middle-income country, and thus Angola needs to pay a much higher price for the vaccine as compared to a low-income country. Now, the problem of that is, of course, that essentially public health and an outbreak is patients are held hostage because of a BNP of a particular country. Yeah. And in general, yellow fever, the accessibility and the price of these vaccines needs to be brought down in order to be able to prevent such outbreaks as this.
What does the picture look with regards to the spreading of yellow fever on the continent now? Some experts say we should be worried. Others say, no, take a more slow approach, an easy approach to this. What are you saying? Should we be concerned even here in South Africa?
Well, I think it's important that, as I said earlier, we remain very vigilant. Of course, if you travel, you must make sure that you have your yellow fever vaccines updated. I think we must make sure now, as in the region, as South Africa, that we implement measures such as monitoring in order to see where the outbreak is going. It is concerning, and indeed, I think, considering where we are now in DRC with the slow arrival of vaccines, these issues need to be accelerated much more.
What about border controls and so forth? Are you guys at MSF, for instance, are you involved in these kinds of processes at all?
So one thing we learned, for example, with Ebola is that when it comes to outbreaks, and yellow fever is another example, of course it's by far not as serious and deadly as Ebola, is that you can't contain it by closing borders.
Yeah.
That simply doesn't work. It's practically impossible. What needs to be done is to afford people to come forward for diagnostics, testing, and vaccination to be made available.
Well, Dr. Pedersen, I thank you very much for